Good afternoon, everybody. This is Robin Young. I'm the publisher of Orthopedics This Week, and here are the top 10 orthopedic and spine stories for the week of January 23rd, 2023. And starting at number 10, of course, are the Power Rankings, where we survey 26 of the largest orthopedic and spine companies, and we order them according to their attractiveness. So be sure to check out either our podcast for Power Rankings or go to our website at ryortho.com and you can read them yourself. So the number 9 story this week is the news that an OEM supplier located in Bethlehem, Pennsylvania, Tiber Medical, has reached across the Atlantic Ocean to acquire Synchro Medical, French-based supplier of foot products, including, interestingly enough, the first ever hammer toe implant with peak material. It's a first of its kind. The brand name is Toe Grip Classic, probably an instant classic, but that does give Tiber, the Bethlehem, Pennsylvania company, which is really well known in the industry, some new and interesting products to feed into their OEM customer base. Our number 8 story is an unusual lawsuit that came out of Michigan. The plaintiffs are alleging that this Grand Rapids-based company, Orthopedic Associates of Michigan, were engaging in monopolistic behavior. No doubt there's a whole lot more to this story, and we do have some rather juicy details at ryortho.com. Be sure to check that out. The number 7 news this week comes out of Texas, where the Texas Medical Association filed their fourth, yes, I said fourth lawsuit against the No Surprises Act. This is an act passed by Congress as a patient protection measure. Who likes getting a surprise with their medical bill after all? But the surgeons in Texas are taking issue with a 600% fee increase. That's an increase from $50 to $350, which is the charge for any dispute resolution. That's a fee for that. It's kind of easy to see their point, right? Be sure to check out the story at ryortho.com. Number 6 is an interesting new study that looked at the explosion of Medicare Advantage patients and checking to see if those patients are getting better or worse knee arthroplasty outcomes. The research team comes out of the Keck School of Medicine at the University of Southern California, and they collected data on a whopping 697,000 patients. That's a lot. So you know this data has some power to it. The answers were, I guess, a little surprising, and it accrued to Medicare's advantage, pun intended. We do have the details, obviously, at ryortho.com. Coming in at number 5 is the prestigious Surgical Techniques and Technology Award, which was presented at the recently concluded American Association of Hip and Knee Surgeons, or as we know it, AAHKS, at their annual meeting. And that person on the right-hand side is its immediate past president, C. Lowry Barnes. He's making the award to the winning investigator, Dr. Jacob Wilson. The winning study was a 10-year patella outcome study. That's pretty unusual, and that's obviously, with a 10-year data follow-up, well worth reading. And we have it at ryortho.com. The number 4 story this week comes out as another award-winning study, this time from Boston's Brigham and Women's Research Group, who nailed the distinguished James Rand Young Investigators Award, also from AAHKS. The study collected revision data from 485,000 total knee arthroplasties, of which 93% were fixed bearing implants and 7% were rotating platform bearing implants. Well worth reading, and which ones tend to result in higher rates of revision surgery. Important information as well. ryortho.com for the details. Number 3 was a really interesting new study. It posed the question, and most knee surgeons try to, when they do a surgery, want to have the patient outcome to be a more stable knee. So in kind of a counterintuitive outcome for this study, they asked the question, Which is more likely to deliver more stability to a knee? Is it a motion implant or a non-motion implant? And the counterintuitive answer is it's the motion implant that delivers more stability than the non-motion implant. Check it out. Great study, ryortho.com. Our number 2 story of this week is about a new doll. We've never done a story about a new doll in orthopedics this week. The doll's name is Chelsea, and she is the newest member of the ever-expanding Barbie universe from the Mattel toy company. Mattel, in case you didn't know, is the third largest toy company in the world. Chelsea, as it happens, has scoliosis. One of the top experts in scoliosis advised the toy company. That's kind of cool. See a doll out that reflects a very real world uh, situation. And our number 1 story is the passing of Dick Stedman, known as Steady to his colleagues and family and friends. Truly a giant in sports medicine and total joint repair generally. Over his long and storied career, Stedman treated an astounding number of Olympic and professional athletes. Indeed, at some point in his life, his reputation among athletes became near Olympian itself because he not only returned athletes to the games they loved to play, but he did so at such a high level that some of their greatest accomplishments occurred after they were treated by Dr. Stedman. He also innovated a number of procedures well known across the globe. And upon hearing of his death, he was honored by NFL, NBA, Major League Baseball, Olympic, and a number of prominent weekend warriors. He was 85 years old when he died. Of course, we have much, much more about the great Dr. Stedman and other stories at ryortho.com. Thank you all very much. I hope you all have a great week this week.